Action. Thank you for joining us here on Constant Counseling, where sometimes counseling is a constant process. My name is DC Constant, and I'm a marriage and family therapy student, PhD student at Florida State University, and I'm also a former alumni of the Clinical Mental Health Counseling Program at FGCU. And today I am joined by Dr. Sherdene Brown-Simpson. She's a licensed professional clinical counselor, licensed marriage and family therapist. I mean, there's so much more other stuff you do as well. And also, she's a professor and program director of the Clinical Mental Health Counseling Program at Florida Gulf Coast University. Welcome, Dr. Simpson.
Thank you for having me. I'm so excited to be here and be in this moment with you on your podcast.
Yes, yes. I mean, I would also say too, Dr. Simpson has been a huge mentor for me in the program and really solidified, I would say, my professional identity as a clinician who wants to work with
Mhm.
couples. Big, big, huge, huge.
Aw,
So I'm
yes.
excited to have her on today. One of the biggest things that I was thinking of is with you, Dr. Simpson, is what would you say it is that really drew you to couples counseling?
DC, before I address that question, I just want to say I'm excited to be in this moment with you,
Yeah.
to have one of I call DC our distinguished alumni who worked so hard in the program and just so committed to couples, family, and systems work that it just my heart just boils over in excitement to be a part of what you're doing now and to be a part of where you're going in the future. So I do wanted to acknowledge just your awesomeness in this moment. Um,
Thank thank you.
Couples counseling is just a passion. What drew me to couples counseling? I think one of the things that I discovered rather early was just the power and the dynamic of the systemic relationships. And even in working with my individual clients, understanding that the individual clients come in with a story that is connected to family, is connected to couples, is connected to who they are systemically, and really being able to look at the rewarding outcomes of watching couple relationships grow, weathering the storms with them, being on a journey with them, being a trusted advocate for them in the process. Another thing that really drew me was I felt that couples work was different. It was my energy. I felt that I came alive when I did couples work. I learned so much about the couples, but most importantly, I've discovered on this journey that systems work helped me to learn a lot about myself, how I respond. It's helped me to deal with some of my own family of origin issues. It's helped me to grow as a person. So I think systemically, is I've been able to help a lot of couples, but in the process, I have seen my own inner healing and growth as well. So that's I would say those are the areas that kind of drew me to this work.
So you saw the power in it for you professionally and personally at the same time.
Yeah, yeah, absolutely. When you work with couples and you work with systems, Dr. Aponte talks so much about the self as therapist, and self as helper. And one of the things that he speaks to is the importance of in working with couples and working with systems that we can't work with a system and not experience our own family systems. We can't work with a system and not grow. Systems work is very reflective, so it's very hard to work with a system and not be reflective on your own journey, and really being able to look at those safeguards that we counter transference, and transference is real, and being able to really identify those areas that as a helper I have to be mindful of as well. So I think it's really come full circle in just my training and working with couples and families.
I definitely hear it when you say that too, Dr. Simpson, because I remember obviously in the program and we're doing our work with couples, I saw the shift in myself even when I started to work with couples. I started to become more direct as a person. I started to identify cycles and patterns. And, sometimes I would see even some of my past relationship stories sit right in front of me with some of my couples. And it gave me a level of insight that I had just never seen like when you mentioned that come alive, I felt that. Like I felt like I was sometimes a gladiator going into the arena. I'm like, okay, what are we going to kind of come across today working with
Yeah,
this couples and reflection,
yes.
because sometimes they're challenging them, sometimes they're challenging you.
Absolutely. And even in that process, that empathy, I think folks working with systems learn rather quickly to be so empathetic because we see ourselves in so many different ways, and it's just increased empathy to what the couple is experiencing, and being able to know that we're on this journey with them, and in some ways, depending on the presenting problem, we may even be experiencing similar stories in our own lives.
Yeah, yeah. It's almost like you talked about this mirror and this isomorphic process sometimes that tends to happen in session with the clients. Mm,
Yes. DC, you brought up the isomorphic process, and yes, it is so enriching because as we learn and grow, we help our couples learn and grow, and it continues. I even see it in your work here with this podcast, the isomorphic process occurring in you now being able to help your listeners grow and be reflective of their own process. This is amazing.
one thing you told me I'll never forget is you said in supervision, if the supervisor is stuck, the mentee stay stuck. If they're stuck, the client is stuck. She's like, so I have to challenge you so you can challenge the system.
Yes.
And that always stays with me. That always stays with me. And it's like you talked about how it's this iceberg process going down the line. If I'm stuck, you're stuck. You're stuck, they're stuck. And I was like, wow.
Yes, 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 yes. All the systems have to work together. And when we look at, systems work, if we're intervening in any system, we have to look at the effect that one system is going to have on the other, especially if we're striving to move our clients into a place of, healing, restoration, change, and seeking that first and second order change process.
And I think that was the biggest thing is that like just seeing how when we had supervision, how you would challenge me, you would say, DC, you need to go ahead and challenge that system. What's preventing you from challenging them? Because as long as you stay stuck, they're gonna stay stuck too. So what's going on in this stuckness? And that's like the new word for me, stuckness. What's causing the stuckness?
What's causing the stuckness and those rich conversations we had, and
Mm,
discovering systemically that as helpers we could cause the stuckness because we're not being direct enough, or we're not challenging what we see in front of us and being able to right those behaviors in order to move the family system or the couple system forward.
yeah, I mean, I would remember sometimes some clients would say to me, I don't always like the way you do things, but you challenge us the way we need to be challenged. They're getting the growth. Because I know you would always mention how sometimes people would go to therapy and it's just like some therapists go, yeah, 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 yeah. And then nothing would happen. And then the client stops showing up and they don't have no idea why that even happened.
Yeah, yeah, it's like, okay. And I will always say they don't come in and just see a statue. They want a human being. And I know you even saw in your own training, once you got in there with them, your retention rate with your clients was amazingly high. Because they knew you were engaged in the system. And even though it was painful for you at times and painful for them, the system moved and it was amazing.
It did. I think, and one of the biggest things I saw too is that you really get out of this content, this problem saturated story. I know this narrative be coming out that problem saturated story sometimes clients will take you in, but you get right back into a process,
Yes.
and I think that really helped because one of the things like I think even from when I would work with clients session one, I would go into like as you say, a little commercial, go into informed consent, all this different stuff, and say, if you're feeling this is what happens. I'm not taking sides, but I'm trying to bring some insight in. And I think seeing that with them, that process of like I said, needing to challenge them, needing to call out the elephant in the room. Because one thing you told me I'll never forget to acknowledge the emotion in the room so you can move past it.
Yes.
that
Yeah.
is something I just will never forget. Like acknowledge it because I learned how I was seeing sessions, I would not acknowledge it. I'm flubbering over my words, trying to make them come to some peace. That's not happening until you acknowledge this. You won't move past it.
Yeah, because what can we do? Can we really do effective work if there's the elephant of the emotion is in the room? It kind of sucks up everything. And then one of the things in just looking at the process is once we address the elephant in the room, then we're able to take the couple more to a problem oriented form of therapy. Because most of our clients, when they come in, they're used to the content of the problem saturated narrative. And as you said, we're trying to move through that and look more at the content of how to process whatever they're going through and teaching them how to process.
Mm. And see, that's the thing with systems work where you have a profession when there's sometimes this personal element. Because I think it was back in October. I had to give a speech for something, and my mind was just such in a frazzle. So I went up to go give the speech. I said, I said one of my mentors, Dr. Simpson, always said you have to acknowledge emotion and move past it. I was like, I noticed this morning I'm feeling a little bit frazzled, and I'm still feeling frazzled, and that's okay. And once I said in the speech, the rest of the speech flowed.
Mhm.
And I was scared doing that in front of a public crowd, but I was like, I had to do it to move beyond it. And so that's like that power I see with systems work sometimes.
Yeah, yeah. So much power because once we own where we are, we're able to help others own where they are. And I think one of the things that I discovered in my own growth that I witnessed in your process is giving ourselves permission to just be transparent and being transparent with boundaries and understanding that at first it sounds scary, but when we try it, it really works.
Mm, mm. It's so true because when you have that transparency, it allows for sometimes even that vulnerability to come into the room, and then you kind of can see what can happen. Because ever since now, even my work with couples, I've even noticed how when I talk to people and I see a certain kind of reaction, I'll be like, "Wait a minute, what did you just hear me say? I know I just said this, but what did you actually just hear me say? What did you just take from?"
Yeah, yeah,
And it
yeah.
takes me back into a process sometimes with people. Yeah. Mm,
Yes, yes, yes.
mm, mm.
Yeah.
This makes me wonder, what do you think are some of like the common misconceptions that a lot of clinicians have regarding working with couples? What are some things you notice with that? Tell me
Mm.
about that for a second.
I think there are several. I think the first one is I think one of the biggest misconceptions is that couples counseling is for relationships that are falling apart. I
Mm,
think that that's a misconception. I could only go to couples counseling if, things are not right. But in reality, some of the healthiest couples seek counseling. They are proactive about their relationship. They may want to strengthen their relationship. They may want to prepare for marriage when we do premarital counseling. They just may want to navigate life transitions when we look at the family life cycle. They may just need to do some transition. Some of them may just need to deepen emotional intimacy before problems become crisis. So understanding that you don't have to be at the end of your relationship to want to seek couples counseling. I think another misconception is that the job of the helper, the counselor, the therapist is to determine who is right or wrong. Because sometimes, clients may come in and if they're meeting with a male or meeting with a female or meeting with another person, they may feel that, oh, you won't understand me and you may think I'm the person that's wrong, but that's really not our role. We stay in a neutral stance, so we're not looking at who's right or wrong, although there are times when we unbalance and align, we may have to address some of the things that we see that's going right and some of the things that's going wrong. I also think that a misconception is that we're not judging and refereeing people.
right.
That's not our role, and that we are really looking at the interactional patterns and how to keep the relationship from being stuck and how to develop healthier ways of them responding to each other. I also think that sometimes people assume that couples counseling is just, oh, they're teaching communication skills. Yeah, important and that's one aspect of what we do, but we get into so much. I mean, we get into attachment needs, we get into emotional injuries, we get into family of origin experiences, we get into how to change relationship patterns, we get into helping couples to as far as what they need to really experience a more fulfilling relationship. So we're so multifaceted in what we do, and I think that sometimes people with a lack of knowledge about couples counseling may put us in a box, but there's so much to what couples counseling is and the work that we do.
It's I'm kind of laughing a little bit to myself when you mentioned about the referee because I had someone say to me, I can do couples counseling. I don't want to be a referee. And I was like, referee? I didn't know this is like the WWE or the NFL, because I don't go in with the striped shirt on.
Yeah, that is not our role. In fact, when we have conflicted couples, we don't want that role.
And,
we
and I think to a lot of couples come in with that apprehension of, is this therapist, this clinician going to understand my side? Is he going to understand me? Am I going to get lost in that? And I think that was the biggest thing I've learned is how to really stay neutral. But I've learned even through this work of how even when you do with individuals, how to work systemically with them, even though all the people that are not in the room, bringing them in the room at the same time. That was something that I learned in working with you. It was very powerful.
Yes, yes, yes. Being able to look at even, with our work with couples, that the couples, both of them, in coming together, they're bringing in two different systems.
Mhm.
And so a lot of times, what are we seeing is that their systems may be in conflict. Their family of origins may be in conflict. And with them, they have to be able to learn how to navigate their relationship, set up their boundaries, their guidelines, and how they're going to move through their relationship with the understanding that it is being impacted by so many other factors.
And when I think about some of those factors that you didn't mention, I look at how sometimes with couples where if they're trying to repair or really kind of restore their relationship, looking at the stages of change. Are they in first order? Are they changing behavior? Are they second order trying to change those unspoken rules? Or are they in third order really shifting their identity? And like really getting a sense of where they are in that process. Because some couples don't even know they're stuck in first order.
Yeah.
And they're trying to get, but they haven't gotten a second order. They haven't fixed those underlying beliefs or rules that they're operating by. And I start to see that now. It's like it's so powerful.
Yeah, DC, you're so right. It's so powerful. And then, when they're in that first order change, I think another part of the dynamic is us helping them to understand that we expect you in the first order change to have some relapse. We expect you
Mhm.
to go back to some of the behaviors that you're used to sustaining, but how can we minimize the return to the relapse? How can we minimize that? What do we need to do in order to sustain you into a second order change so you could really move forward in a relationship? And I think one of the things that we do systemically, which is strong, is that we help couples to not feel, I don't know if guilty or as like they're failures if something happens and they do relapse. We see it as a natural part of the process, and we just encourage them to do what they have done previously at work, do that again, so that we can move them into a second order change. And I think that's such a dynamic part of the work that we do.
Because I feel like now sometimes I'll joke amongst myself. Sometimes I'll be watching movies and shows. I'm like, I'm wondering who was in first and second order. It's become such a part of who I am looking at that because I think with couples work, I think coming in to the program, I was in practicum and I was begging my practicum instructor. I was like, when do I get a couple? When do I get a couple? When do I get to work with a couple? And then once that happened, when I saw the shift, when I saw how it was like a roller coaster ride they were taking me on, and I'm going down with it with them, going up and down. And I started to see how, as a clinician, I feel like even my counseling skills are like 10x'd the whole
Yes.
time. in that process, like quicker than I think they ever have because couples work, it moves quick. It moves so
Yes.
quick. Systems work is so quick. Like, you know, it really
Yes.
makes you kind of you have to think on your feet in a lot of ways, and it really challenges you in ways that you would never imagine. Yeah,
Yeah, you're so right because I don't think we cannot afford to not be in the moment
yeah.
because everything is happening so quickly and we become a part of the system. When we look at individual counseling talks about this, building rapport. And I see it as years go on, the importance of why in systems we call it joining. Yes, we're building rapport, but we know rather quickly we have to join that system temporarily in order to get that system to change because we know that train is going to move so quickly and we have to be on the train with them and not just watching the train take a journey. And I think that's so different with the work that we do systemically. We're part of the change and we
Mm,
impact the change in so many different ways.
mm. And when we think about this like impact with the change, it makes me think about the aspect of I think one of the most powerful tools you've given me is the systemic hypothesis. And I just wonder if you could speak to a little bit about the power of that and what have you noticed and incorporate that into your work with clients, with couples and individuals too.
That systemic hypothesis. I remember asking you, DC, what's the systemic hypothesis? One of the most powerful concepts I would say in systems therapy is understanding that people don't exist in a vacuum.
Mm,
People exist in relationships, people exist in systems. So, a systemic hypothesis helps us to move away from asking, who is the
mm,
problem? And instead, we ask, what is happening within this relationship or what is happening within the system that keeps this pattern going? So, rather than us viewing one partner as the identified problem, we create what I call a curiosity about the cycle.
mm,
So in the curiosity with the systemic hypotheses, we're thinking, how does one person's behavior influence the other's response? We're thinking what emotions are driving those reactions. We're thinking what patterns have developed over time. When we understand the cycle, now we understand that we could begin to affect change. So when you look at the systemic hypotheses, what is so fascinating is that this perspective is not only valuable in couples counseling, it's even valuable in working with individuals. And when you begin to really convert into being a systemic thinker, you look at how the hypotheses can really explore so many different aspects because with our in family work, we're looking at so many influences. In our individual work, we're looking at so many influences. One of the ultimate um, keys with the systemic hypotheses is that as clinicians, it shifts our focus from blame to understanding. So when we're sitting there, it opens up a lens of understanding so that we know that when our clients recognize this cycle, not the person, not each one of them individually, but when they recognize that the cycle is the problem, the cycle, the interactional cycle is the problem, that helps them to become more compassionate. It helps them to become more collaborative. It helps them to become more capable of creating lasting change. And I believe that's where some of the most beneficial and meaningful healing occurs in that systemic hypothesis and sharing it with our clients.
Also I've noticed with that too is that this powerful aspect of the systemic hypothesis is when we physically present it to the client. It's one thing sometimes we reflect to someone with cycle in, but another thing when this is a cycle based on what you've expressed to me. And their names are on, they see it and they take that copy home. And it's like, because sometimes I would see clients just go into emotion like, whoa, this is what I've been in. It's one thing to talk about it, but it's another thing when you see it on paper.
Yeah, yeah, yeah. And I think, they appreciate it. And sometimes for them, it's hard to disagree with the observations, because we're seeing it through very neutral eyes. And I think I've discovered that a lot of clients, they're even amazed that we were able to create a systemic hypothesis in 1 to 3 meetings with them. Hmm.
Yeah, yeah. Yeah. And I think that's the thing too, because now that I've become such a systemic thinker, I'm always looking at cycles and patterns and what happens right before, like, and I think that's helped me conceptualize a lot of things. When you're working with people who experience depression, anxiety, first thing is what happens right before you start to feel that?
Yes,
What's reinforcing, or as you say, what's increasing those feelings of depression or anxiety? What's reinforcing that? What's happening right before? Helping me to identify what's really happening in their world that
yes,
is reinforcing some of these things or these symptoms that they're feeling.
yes, yes, yes. And it helps to have them to understand that, I'm not off. um, that a lot of this is just a normal pattern of interaction that we have settled into. And now let's look at how to break the cycle. And it really, eliminates the blame game, because we don't look at blaming people, but creating insight in how one person's behavior is affecting the other person's response, and giving them the power that this can be changed. It can be altered. We could create new stories. We could create, different, unique outcomes based on, what you're currently, doing in this relationship.
And I think one other powerful aspect too is that family of origin, looking at where they learn behaviors from. I think something you taught me too is, when working with clients, even asking them who around you handles things similarly. Because sometimes clinicians will go right to the parents. It could be the uncle, it could be the aunt, it could be the distant cousin. Got
Yeah.
to really bring it.
Yeah, so sometimes we have to pop those circular questions in because we need more information. And like you said, once we're able to, look at that family of origin, what do we start seeing a lot of times? Those multi-generational transmissions that now they're playing out in the relationships, and our clients had no insight prior to us sharing that information with them. And that is such a powerful dynamic in the systemic hypotheses and helping the couples to take a step forward.
Yeah, because when you look at that and you pair it with the systemic hypothesis and you're showing the clients these patterns, it's like, okay, when you notice this part of the cycle coming up again, you can ask yourself the question, how do I want to respond to it this time?
Yes, 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 yes. And looking at, I know you are so narrative lens. And looking at how they could reauthor their stories, looking at how they could create unique outcomes. And it is also, I think, empowering to the couples to be able to know that they are owning their change process and that they can do it. And do it without us, because the intent is not for them to be with us forever, but to spend a time with us and then to be able to sustain their relationships when counseling is over.
Yeah, and I think what's powerful about that is too, because like they become proactive in the change process. Because I think a lot of them come in like, okay, you're gonna tell us what to do. We're gonna get this thing moving. But it's like, really what we're trying to do is help you sleep facilitate change a relationship, but change that you can own, change that you are a part of. Because that's
Yeah.
something you're gonna be consistent with,
Yes.
you
Yes.
know? As opposed to me telling you all these things. I think that's always the ideal. I'm gonna go to
Mhm.
therapy, I'm gonna get some advice. Someone when they come in, we need some advice.
Tell us what
And
to do. Yeah. Tell us what to do.
tell us what to do. We want you to tell us what to do, you know? And I always just let them know, like, I'm not here to give advice, you know? I'm here to help you facilitate change, but change that you can own, change that you are a part of, change that you're going to co-create. Because I think one of the things you always taught me when working with couples is to never ask a question, "Are you committed?" but to ask, "What is your level of commitment?"
Yes.
Because everyone's gonna
Yeah,
say yes, yes, I'm committed, I'm
yeah,
committed. But what is
yeah.
your level of commitment? You're gonna
Mhm.
really see
Really,
where they really are at in this process.
yes, 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 yes. Yes, and it's two different questions because from a process orientation, we need them to be committed to the process. We need to know that they're committed to the individual level. We need to know that they're committed on the couple level, and we need to know that they're committed on the intergenerational level because all of those factors are so important in us being able to move them to where ultimately we want to get them to a second order change and moving into their relationship without us.
So I think sometimes you'll see clients that will go into this, oh, I don't know, and they're putting all the responsibility on you. But you told me how a child's back, like, is that you don't know or that you don't want to say?
Yeah, yeah.
Yeah,
Because it's work, right? Because one of the things you've learned rather quickly, couples work is not for the faint at heart.
it's not. It's
It
not.
is the most rewarding work I feel in counseling,
Mm,
but it's work. So and going back to what you introduced earlier, with the isomorphic process, we come in ready to do our work.
mm,
They have to come in ready isomorphically to do their work. And if they're doing their work and we are doing our work, then the system will move forward. It could be challenging if we're doing all the work and they're not working. And what is one thing I used to always say? Hey, I used to tell our class, you're not going home with them.
right.
They gotta kind of own this relationship because it's not your relationship. They have to go home without you. So there's a sense of ownership that they have to have.
Yeah, I think that's something you always told me is to not own so much of their change process.
Yes, because in the beginning, what in the beginning you were stressed, like and it's like and it was so interesting because you had so much passion that you wanted them to change
Yeah.
so badly. You wanted them to do it. And you happened to have couples that at the time were like, I don't know if we want to do the work. And so you came in working. I remember saying, DC, do you think you're working too hard? And finally, at first you said, well, and then finally you said, yeah, I think I am. And when you got there, you finally kind of woosah and stepped back. And when you let them do the work, it was amazing.
Yeah, I had to let go because I feel like I was becoming their couples counselor, their financial advisor, their case manager. And I was like, yeah, I have to let go because I'm going to be taking on all the roles.
You had all the hats. If they needed this, you would go here. If they needed that, resources. And finally, I had to watch you and allow you to get exhausted to say, that's not, no, that's not why I am here. No, no, no. Hmm.
I think you told me one supervision. I think there was couple I worked with and they reached out to me 11 o'clock at night email. I responded back to them and I was telling you this supervision. You said, can you pause for a second? I said, DC, can you tell me why you were answering an email at 11 o'clock at night? Can you tell me why? What are your hours in the clinic? Tell me what those hours are.
11 o'clock at night, spring break, holiday break. It's like I would get these messages like, so, blah, 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 and I'm like, no. No, we're closed. And you were like, okay, how can should I, okay, okay, no. And then you got to a place where you said, you know what? No,
Mm,
no,
mm.
this will be good. It could wait till our next session. Yep. Hmm.
You also talked about how this work is so rewarding. What's been the most rewarding about it for you?
I would say very selfishly, my personal growth. I think that I came into my own self as helper and working with couples. I
Mm,
think it just helped me working with systems to become more direct,
mm,
to understand change process, to allow myself to be vulnerable in the change process with my clients. So I think
mm,
number one, I grew a lot. I've noticed that over the years. I think secondly, in being able to be what I call a hope holder,
mm,
to know that when couples come in, they could be so hopeless. And if I could identify just 1% of hope in them, I know that we could do work. And some of them, it's hard for them to get to 1%, but being able to be the hope holder. So I hold hope until they increase their percentage. And I am so delighted when we terminate to be able to give hope back to them and to know that they started at 1% and now they have so much hope for their relationship and they're ready to move forward. I think that has been my heart fulfillment and the tear jerking moments in my life as a clinician. Hmm.
Bring out that hope for them.
Yeah.
Yeah.
Hmm.
Yeah, especially when they're struggling to hold on to themselves.
Yes. Yes.
Mm,
When they want to come in and they say, if this is our last stop, if this don't work, we're done.
yeah.
That's and you've been in those places where there it's
Yeah.
like if this okay we don't
This is
make it
it.
on this stop, this is it. That's a lot of pressure for a clinician, but
Yeah.
also it's rewarding when they put the work in and they get
Yeah.
to a place where we're going to be together forever
Yeah.
and we're
Yeah.
ready to weather the mountains, the valleys, but we know it's us and they're vested in their relationship. That's just like that's the ultimate. That's the
Yeah.
best. Hmm.
Because I think so many of them come in with this kind of apprehension, this fear that they're going to be judged, for all the issues they've got going on, you know? And I've seen it a lot where they come in, there's like this apprehension. Of course, that's when you have to come in with the joining, but there's this fear like, is this person going to judge us? You
Yeah.
know? How bad are we? How bad is this relationship? They're nervous. And I always see that apprehension sometimes, that fear in them when they first initially
Yeah.
come in.
That fear and that lack of vulnerability, and you know from your own work with couples is that we're trusted entities,
Mhm.
but it's a process of getting them to trust us because in their fears, in their apprehensions, they have to share with us the most intimate stories of their lives. And that is frightening that you walk in and you don't know this person, and there's such depths of intimacy that they share with us that it's just like it's amazing. So they're afraid because they don't know. And when you are honored to be on a journey with them and they're sharing that level of intimacy, I could understand and you saw in your own growth and understanding why they're fearful because these are stories that a lot of times DC haven't we even discovered that some of it they haven't even shared with each other.
Yeah.
And so we're in sessions where things come out, it's like we're all the first to hear it because they've never said it, but we know that when they get to that place that fear is decreasing and they trust us to get so intimate and to allow us to be a part of that. That could be risky for them. Hmm.
Yeah, yeah, it's
Hmm.
powerful because there's something I always say with couples counseling is like they come in and they bring all this vulnerability to the table because I mean your system, part of your system is in the room with you, so it's gonna bring that vulnerability out a lot quicker sometimes than you'll see in individual work. So you're gonna get that Barbara Walters exclusive with this is the first time they're bringing something out there to discuss,
Yes.
and sometimes this is years of a feeling or years of maybe
Yeah.
past stuff or past trauma that's being brought on the table. And I think that's something that I've seen that I was like, I really take it to heart because I know
Hmm.
that's not
Hmm.
easy. For someone to
Hmm.
say, this is what's happened in my relationship. This is
Yeah.
what's going on.
Yeah.
And you're really kind of putting yourself out there and really hoping to
Yeah.
see, okay, what kind of change can be facilitated from this?
Yeah. Yeah.
Yeah.
And you said something. I'm just thinking back in your development is that professional disclosure with boundaries. And I think that change happens when we allow ourselves to be also professionally vulnerable
Yeah.
and that self-disclosure that is going to move them. And what did we always talk about? They don't need the details. They can't handle the
Yeah.
details. But there's a level of disclosure and systems that we avail ourselves to be vulnerable in order to help the system move forward. And I think that is so valuable as well. Hmm. Hmm.
Because I know sometimes though couples will come to me and say, "Do you think this can work?" Or what are them will stop me in the hallway. Do you think this relationship can work? And my response is always, "I think any relationship can work if both people want it to work and are willing to put in the work." That was
And
always
that's
my
the
little commercial.
commercial.
That's
That's
my commercial.
that's my commercial, and I'm sticking with it because it works and it's true.
So-
Yes.
Something I'm curious about here, Dr. Simpson, is, you know, just say to students who are conceptualizing what their future journey could be as a clinician.
Hmm. 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 Whoa. In 10 seconds, I believe, and this is just my own life philosophy. I believe I am an advocate reader of Stephen Covey, and I believe his leadership principle begin with the end in mind. I believe that in your career journey, that you should dream and see yourself at the end of your career and where you want to be. I don't think that we teach that enough. I don't think that we do that enough. I think that we train for today. We train for the next couple years after commencement. I believe that is very limited. I believe that we have to begin to see ourselves. And once we can see ourselves in whatever position it is, then we put things in place to be able to get there and not get to the end of our careers and now we're scrambling or we feel that we have wasted our career ladder. So start planning your career ladder as soon as you get admitted to a graduate program. Is it a lot? Yes. Can it be taxing? Yes. But you're positioning yourself. You're positioning yourself. So you're going to those conferences, you're joining those professional organizations, you're looking for those extra training. Once you get licensed, I don't believe being a generalist is the end all or be all of counseling. No, no shade to my colleagues. I get this heat all the time, but I truly believe that being a counselor is one of the best careers because you can reinvent yourself in so many different ways. If you want to teach, teach. If you want to be a researcher, be a researcher. If you want to be a clinician, be a clinician. If you want to be on a talk show, be on a talk show. If you want to have retreats and train and do whatever, do it. Do it because there's so much more. I believe that our field is bigger than productivity. It's bigger than productivity. It's bigger than being frustrated if five clients no show and you're trying to wonder if you're going to get written up. It's bigger than that. And I am an advocate that if you could dream it, you could do it. It is attainable, but you have to do it. And lastly, you got to connect in this field, and we don't do that enough. We have to connect with visionaries in our field. We have to connect with those movers or shakers that they say when you're done with your master's. Most people say, "I want to work." Cool, you're gonna work the rest of your life. Go get a doctorate. I mean, if you live and die, you will work. Go get a doctorate. Go get some more training. Go get a certification. My end all and be all, and I say to all the students, and some receive it and some don't, you have to ask yourself, what do I want to be known for? In this moving and shaking world, it is not who you know.
Mm.
It is who knows you.
Oof.
Because if they know you according to your specialty, they will find you. The people I have worked with is not because I knew them, because I didn't. It's because they heard about the work I was doing and they came to seek me out. That's when you moving and shaking. And we are in a place where we don't move and shake enough. Hmm.
Mm.
Yeah,
That's so powerful. I
yeah,
think that I really resonate with that, Dr. Simpson,
yeah.
because I think coming in as a student, like you obviously know that I had like a vision. Like you have even helped
Hmm.
me even further cement my idea, my not my idea, my conceptualization as a clinician who works with couples and obviously doing wanting to do sex therapy as well. Because when you talk about the end in mind, it's such a powerful thing because I've had some people come to me and they wanted to learn about going into a program, all this other stuff.
Yeah.
And I was like, well, where do you see yourself?
Hmm.
What do you see yourself doing? What is it that you want to even feel when you
Yes,
get there to think
yes,
about that? And I totally agree with the power of specialization because I think that in a way that one thing I realized in life is how do I say this? I'm not called to serve everybody.
yeah. Hmm.
I'm not
Hmm.
called to serve. I'm not
Hmm.
called to do everything. You know, I realized in life that I always say that I feel like I'm called to serve who I'm meant to serve. And I feel like the way that I show up in that work, the way that I like, because like I said, when I work with couples, there's a part of me that comes alive. And somebody told me something years ago, and they said to me that you will have endless energy to do for what is yours to do. And if you don't have endless energy for it, it might not be yours to do.
I agree. Yeah.
And I started to really think about that, how I would show up in that work. And, I always I think in my MBCC fellowship, being around other fellows who are
Yeah.
really specialized and have these targeted populations,
Yeah.
and the way people just come alive for that.
Yes.
Your heart is there, your passion is there. Because I mean, with couples work, it's definitely not for the faint of heart. But when I have a challenge in couples work, it isn't like a challenge for me. Okay, like my brain
Yes.
starts going. I have endless
Yes.
energy for it.
Yes. Yes. The
They get
passion.
upset, they challenge, all that stuff. Yeah,
Yeah. Your passion leads to your purpose, that leads to a fruitful life that is going to pay you in so many ways.
yeah. Because that's how I just knew when I was in the program. I was like, I have to keep work. I work with those rivers the whole way through. I was like, I have to because my heart is in that work. Like I cannot deny it. Like my heart is in that work. It's something about it. It's something about, like I said, I'll challenge them. They challenge me. I see the
Yes.
personal and professional growth and the
Yes.
endless energy that I have for it. And when I learn, I'm like, this is always how I conceptualize my journey as a future therapist. This is exactly how I've always seen it. So even
Yeah.
just to think about the impact I want to make in this work. So it's, and that's why I want to say, like with you, you have been I think I've had many mentors, right? And you're just one of
Mhm.
those few mentors that have just been so amazing in this process,
Mhm.
helping me conceptualize and cement what I see from my
Mhm.
journey, right?
Mhm.
And also how to be, how do I say it, graceful but personal at the same time. Because it's not
Mm.
everybody that can do the two. It's not everybody that can do the two. So
Mm.
I think that has been a way of showing me how to be that professional or
Mhm.
personal person
Mhm.
as well, because this is
Mhm.
relational work.
Yeah, it is. Yeah.
Yeah.
And you have been called to impact this field in so many different ways. And I cherish the talks that we had, um, and just to see just the fruitfulness of how you are conceptualizing your future. You have always been forward thinking in what you want, and it's just amazing to just to watch you to kind of unfold the next chapter, and now stepping in a role, and I'm not even going to say now step, because you were doing it while you were here, mentoring your colleagues along the way. um, People were coming to me at the end. All the listeners need to know this about DC. Third year of the program, DC's cohort was graduating, and people were coming, students were coming like, I wish that I would have taken those classes.
Mm,
I wish that I would have done the work, because DC has been such a role model in
mm,
doing the work and helping us to see. And for colleagues, your colleagues to say that about you, is that it's just it's something for them to seek you out, and not just your colleagues, but even cohorts after you,
mm.
to come and they would seek you out like DC. And so you have left, and I was joking when we started, but I'm not joking. You have left your name in the hallway of impact, which is what this work is all about. Impact. And I want to stay, I will be ever connected to you. And I appreciate this opportunity, um, because I know you're going to do great things.
Thank you so much for that. I think, like I said, Dr. Simpson, I
Yeah.
think you always talk about with the end in mind. That was
Yeah.
a place I continue to operate from when I heard you say that. Like, because in the program, even though I know I was a student, I was like, I'm living from the end as if I'm already licensed. I'm coming in there,
Yes.
So when I come in the clinic, I'm thinking, I'm coming in this like I'm coming into a group practice. I'm coming
Yes.
in, I'm getting my interventions, my
Yes.
tools, I'm getting all this stuff.
Yes.
I was always thinking, I think from that place, because there are times I work with clients and they would say, we just being honest, we weren't sure what to expect with the student,
Yeah.
you know? But
Yeah.
I came in there with the idea of, yes, I am a student in this program, but I want to come in and give my full, as if I
Yes.
was already licensed. I want to bring that energy into this moment, you know, into that moment with them. Yeah, yeah.
And you did that. You gave them the passion and the heart that was just amazing. You didn't say, I'm just a student. Like you said, you didn't do that. You gave them the most amazing counseling experience that they will walk away and say, yes, that was good. Mm-hmm. Mm-hmm.
Mhm,
Mm-hmm. That's
mhm.
impact.
Yeah,
That's impact.
definitely is. It is. There's that
I told
impact.
you you left your name in the hallway. Absolutely.
But
Hmm.
Dr. Simpson, I want to thank you so much for just
Absolutely.
coming on. I was so excited for today's episode. I was excited. Let
Likewise.
me tell you, I was excited. So
Likewise.
I was excited to have you, and I want to thank you for just one, just being such an inspiration, I
Mm,
think, to me, and honestly, a lot of students in the program. You know,
mm,
are really just inspired by you. I think just the way you think beyond
mm,
the systems that you're
mm,
a part of. And
mhm,
that's the biggest thing. So I think
mm,
it's nice to just be able to see and experience that in real time and really, I think, helping to shape the students conceptualize their journey beyond the program because most students don't think about it until graduation hits, you know? But I really, so I just really want to thank you for allowing and giving us a little bit of that opportunity to really
mm.
conceptualize beyond our journey. So I
You're
thank you for
welcome.
that.
And thank you
Definitely.
for this invitation to be on your special podcast. Oh my gosh,
Definitely.
thank you. I
Definitely.
appreciate the invitation. And I
Definitely.
likewise was so excited to be here. It's like, okay, no one's stopping me in the hall. I am going to my office. Do not disturb. I'm going to spend some time with DC in a podcast. So thank you so much for the kind invitation. I appreciate it.
Definitely. Stay on for a few minutes
Okay.
afterwards. But I want to thank you for coming on and I want to thank everybody for listening. This has been Constant Counseling, where sometimes counseling is a constant process, a podcast for mental health students and professionals. And I will see you all in the next episode. Thank you so much for tuning in.